As Jhpiego, we work to transform, save lives, improve health, and transform futures. Jhpiego is mainly interested in the lives of women, and we are a health program, health organization.
The Challenge Initiative, which is TCI, is a Bill and Melinda Gates funded project, which is currently implemented in over 15 countries. However, it operates in what we call hubs. So in East Africa, it is being implemented by Jhpiego. So Jhpiego is implementing it in Uganda, it's implementing it in Kenya, it's implementing it in Tanzania. When you go to other countries, all other hubs, it's being implemented by other partners. For example, India, it's implemented by PSI, Nigeria, it's implemented by CCP, and Francophone West Africa, it's implemented by IntraHealth.
So TC and Jhpiego realized that there is weakness in the government health system. So as an NGO, they identified these gaps with the Ministry of Health and requested them to tell us where do they want TCI and Jhpiego to come in to support them. So one of the areas they identified that it's family planning, and that's our area scope of work. We said, okay, if it's family planning, how best can we help you?
Specifically for what happened last week, we had two activities that took place. We had the integrated outreach that took place in Kisenyi and the 72-hour makeover that took place in Kawempe Mbogo.
72-hour makeover is ideally turning around the look of a facility in 72 hours. We work with the community, the local artisans and the local community.
So for this activity to be achieved within 72 hours, there was a meeting which was primarily organized by the community, which was a number of discussions on how it would be done. So these teams had to agree that within 3 days, they need to divide themselves into two groups. That's the group which will work during the day and the group which will cover the night.
The ceiling was all leaking, and sometimes we could just put basins to trap the water that was leaking on the floor, and sometimes we could put mops to still clean up the water which was leaking on the floor. But the surrounding around the health center was all dirty because paint had taken really some time without putting another paint, and the whole cement was somehow broken. We had no separate room for family planning.
So when they approached us to work on their facility, citing that they need a place where they can be able to access family planning and also promising to cost share on the costs of this facility, we thought that it was an opportunity to give them a facility where they would be able to receive family planning services. And already from what we are seeing, it looks like the women are very excited and their husbands are equally excited to be able to get a facility in their vicinity that is well equipped to offer them all family planning choice and methods of their choice.
The whole building was painted, and a new family planning unit was created and equipped with the equipments, with a bed for examining mothers. Also, the maternity wing was also created with a new bed for delivery. Partitions were well placed, and the doors were replaced again with the locks. Everything was made clear, and you can see now the environment is clear to provide quality health service.
We are very optimistic that our partnership is still lasting. We know that we've received visitors from the Comic Relief, and we are optimistic that they are still going to channel more money for us to continue saving the lives of the women and transforming the futures in this country.
We had an outreach which was unique in the sense that we have been having outreaches for family planning, but this one was unique in the sense that we held it in a population which actually was in need of such an outreach.
This outreach, basically, we take services from the facility setting and take them to the community level. So it's a team of trained, competent service providers. They move with their facilities, they move with their medicines, equipments, beds, and all that, and they establish, a facility.
We first of all thank the Comic Relief through Jhpiego that they have come to rescue. Before they came on board to work with us, we had attempted and reached a number of IPs dealing with the maternal and the child health, but the only IP who came in to rescue us was actually Jhpiego. Jhpiego has come at the right time. Despite of it being new, it has come at the right time.
Kisenyi houses close to 50,000 people, men and women, that work there on a daily basis. It is one of the areas that has the urban poor women who we are targeting in this challenge initiative. So we intended to take the services closer to them. These are men and women who spend most of their time seated on their stalls and cannot go to a health facility.
So we are in Owino market for the 3 days, and we are offering family planning services, both the short-term and the long-term methods. We also had the screening of cancer of the cervix in the same outreach place. We were also screening non-communicable diseases, and these are diseases which include hypertension, which include heart diseases, which include diabetes. We also had HIV counseling and testing on that day.
Now, whoever would be found positive or whether blood pressure would be found high, we were linking them to referral facilities where they would undertake care, or they would be enrolled on care.
So from the results that have been shown already, clearly in a single day, we were able to serve 5,000 people with more than 100 new acceptors of family planning.
The good part is that this outreach is not a one-off. The number of outreaches, we actually conduct about 3 outreaches per month. This one was particular because the visitors were coming, but we realized that the demand in Owino market, like other places, is overwhelming. And actually, before we end the program for this year, which is ending about to 15th of June, we are planning to go back to Owino and serve them with the same services, and they have already started mobilizing themselves, and they are suggesting some days that we should go back and give them a similar service, which we are ready to do because we still have resources which were given to us by Jhpiego.
Yes, integrated outreaches, especially 3-day integrated outreaches, is one of our high-impact innovations, something that we think brings services closer to people and increases utilization. So moving forward, we are going to work with Kampala leadership to ensure that these outreaches continue, not only in Kawempe, but even in, not only in Kisenyi, but even in other slum areas like Kawempe, Nakawa, and all those other areas where the urban poor people can be reached. So we hope that in the next few years, with our marriage with Kampala, these people should be in position to get services, and we should increase the contraceptive prevalence rate in Kampala and reduce the unmet need.